So, sir, can you see slides?
Yes, sir. Yes, slides are.
Okay. Respected Pawan sir, Tapan sir, and respected Mukesh ji and Aishwarya doctor. At the outset, let me convey my sincere regards to the organizers for giving me such an opportunity to share some of my views regarding the history taking during Ayurvedic diagnosis. Within a short span of time, Tapan sir, I think very detailed description about an Nadi Pariksha and how we can identify the or diagnose the cases with respect to the body, surface, and doshik and dhadu, ubadhadu, all detailed explanations have given very beautifully. After that, Mukesh sir also described the personalized medicine, importance of personalized diagnosis and therapy. And in this session, within a short span of time, I will try to cover the subject history taking, how we can stick on to the importance of history taking while we are assessing a patient in Ayurvedic profile. I will try to limit or conclude my subject within a short span because I think the delegates are not here. Within including our speakers, I think 9 or 10 members are there. So I will try to conclude this session very speedily. As you know, in the clinical medicine gives importance to history taking because the pattern of disease can be identified by properly taking the history of the patient. In modern science also, they are very important, very intentionally saying the importance of history taking. In Ayurveda also, if you see, Roga Pariksha and Rogi Pariksha are the two methods for the diagnosis of diseases and patient in Ayurveda. Actually, from the Nidana Panchaka, we are assessing the Roga, and from the Dasana, Sparshana Prashna and Dashavita Pariksha, all will help us to assess the Rogi also. Actually, while we assess the external features or external signs and symptoms of a patient, actually, we should assess, we should infer, or Anumana Pariksha, Anumana Pramana should be there to assess the internal pathology, internal samprapti that had happened inside their body long years back. Actually, a presentation or a signs and symptoms happens as a result of a long pathology or samprapti that happened inside their body. So, years back, there will be Sanchaya, Prakopa, Prasara, and after that, in a place where Sodo Vaigunya is there happens the Sthana Samsraya or Samprapti. So then the Vyakti and Bheda happens. So while taking the history of the patient, we have to assess this Samprapti, where happened and what is the status of Samprapti. So essentially, there will be some particular events in their body after which the Samprapti happened or signs and symptoms manifested. So essentially, there will be some Pradilomata and some type of Ama will be there, Agnimandya will be there, Doshagopa will be there, Dhadu Dushti will be there, Srodo Dushti will be there, Krimijanma will be there, Ojonasha will be there. So these are the essential events happened inside their body previous to the presentation of the signs and symptoms. So while assessing the diagnosis or while diagnosing a case, it becomes very essential to assess the status of Samprapti in these patients. So, as per Ayurveda, systemic diagnosis means assessment of the Samprapti. So, for each and every patient, we can frame or we can assess a diagram like this. This much Pradilomata will be there, this much Ama will be there, this much Agnimandya will be there, this much Dosha Vruddhi and Dhadu Vaishamya will be there, this much Srodo Vaivun Dushti will be there. Like that, we can assess or we can judge a patient according to their samprapti. So most often, patient's concern will be the the symptoms that creates problem in their body. For example, sometimes they will complain about the hair loss, or sometimes they will complain about the spot, whitish or hyperpigmented spots. Sometimes they will complain about the some numbness over their neck area, like that. But actually, doctor's concern will be to assess the samprapti khadagas properly. What is the status of the samprapti in their body? Whatever may be the signs and symptoms presented over their body, the samprapti status should be assessed properly in order to assess the patient as per Ayurvedic profile. So, for that, we have to take the history of the patient properly. Otherwise, we will confuse about the final diagnosis. We have to assess the status of the samprapti. For that, we have to take the history of the patient and how this is not very similar to the modern history taking. We have to assess the samprapti of the patient's samprapti according to the history and how these are contributed to the samprapti. How this history or how the nidana contributed to the samprapti, proper samprapti of the patient. So we have to assess the status of pradilomada, status of nidana should be there. How the pradilomada happened inside their body. How the pradilomada status or how the ama formed in their body, how Agnimandya created in their body. Like that, each and every factor should be assessed properly with respect to the history of the patient. Because as per the definition of samprapti, yatha dushtena doshena, so how the dosha is vitiated, or how the Srodas got the Vaigunya, like that. So the proper history gives guideline about the pathway through which they traveled to particular samprapti. So in order to assess the pradilomada, we are asking the questions while taking the history of the patient. We are asking the questions whether you have some upper respiratory allergies, headache, heaviness in chest, cough, stomachache, constipation. We are asking these questions. These are through Prashna Pariksha, we are assessing the history of the patient, how these are happened, because these are the Udarta Lakshanas. The Pradiloma Vayu, Pradiloma Vada creates these problems. So, assessment of these Lakshanas through the history taking, that will give the status of Pradilomada in these patients. So, it becomes very essential to take the proper history of these patients. For example, in patients with Echin vulgaris, we can ask some questions related with the Pradilomada. Then they will tell that they were having the history of upper respiratory allergies, headache, heaviness in chest, cough, stomach. Most often they will complain these problems. So we can select the proper anilomana drugs for the reversal of the samprapti itself. Actually, the diagnosis means the totality of that samprapti. So, in order to reverse that samprapti, we have to assess the status of each and every factor through history taking. For example, you see, to assess the samatwa or the combination of ama with the doshas, we are asking some certain questions in order to assess the history, whether they were having the history of abdominal fullness, raised body temperature, heaviness of body, acid belching, force smell, anorexia. These ideas, these factors, or these symptoms or signs and symptoms in recent past will give some idea about the status of sama in their body. So dhatu leenatva also should be assessed. with the help of some upashaya also we can test the dhadulinatva of the samprapti. So in this case, these are some cases related with the samatva or dhadulinatva. So in these cases also we have to assess these patients. Why we have to ask the questions regarding the history, the signs and symptoms in previous past, whether they were having these signs and symptoms. By taking the history, we can correlate these symptoms with the samatva or ama combined doshas or dhadus in their body. So dhadu vaishimya also, we can ask certain questions to assess the status of dhadu vruddhi and dhadu kshaya also. So srodho dushti also. In the case of srodho dushti, we can ask the while asking questions to assess the history of the patients. Not only the modern clinical analysis, there are some certain questions to ask in while taking the history. In addition to these questions, we have to ask certain questions in order to assess the status of srodho dushti also. So we have to ask the questions whether they were having the krimi nidanas in the recent past, whether they are having the habit of taking the pishtaharas, madhuraharas, like that also. The history also infestations history also we have to identify. So let me conclude this session. In the diagnostic aspect, we have to assess the history in terms of pradilomada, amatva, samatva, dosha vruddhi, gata dosha, dhadu dushti, srodho vaigunya, krimi, sattvam, doshi visham, nidanam, etc. So in the case of Ayurvedic profile making, we have to ask the questions directed to directly directed to the samprapti ghatakas. In order to assess the status of samprapti ghatakas, we have to ask questions like that. We can judge or we can assess the status of samprapti in these patients. So let me conclude this session by this. Thank you, sir.